Okay, good afternoon, everyone. We will start. So I hope you can all hear me. Please mute your phone, mute your microphones, and we will start. There we go. So good afternoon, everyone. Today is an important day. My name is Mariam Jam, Lady Mariam Jam. I'm the founder of I Am the Code, and I'm so honored to host this event as your moderator. And what we're doing today is really, we are having an event. It's a virtual event, and it's to celebrate the International Day of the Girl Child 2020. With COVID-19, we cannot do this physically, but I'm hoping that by the end of the 2 hours we have, we will learn so much, and we have so many amazing people who will be speaking with you. So the theme is Why Girls' Health Matters Now More Than Ever. And I was a young girl growing up in Senegal. I live today in the United Kingdom, but when I was a young girl, I was not taught cervical cancer. I didn't know anything about cervical cancer. So it's an amazing topic. It's interesting for the world to hear. So today, so I'll just tell a little bit about myself so you know why am I doing this. I'm a technologist, so I'm a coder. I use coding programming languages to help government, private sector, and investors to invest into girls' education, including health. I believe that health matters. When a young girl is healthy, she can serve her country, but she can also serve her communities. So I'm gonna stop there. You can find my name online, mariamjam.com, or you can go and find me on Twitter. But let me start today by introducing extraordinary human beings. Your Excellencies, we have distinguished guests, ladies and gentlemen, you are very welcome to this webinar. We're celebrating again, like I said, the International Day of the Girl. Why girls' health matters. Please write that down. Why the health of young girls matters, and I hope that we will answer. We'll have those questions answered this afternoon. So the event is hosted by the Organization of the African First Ladies for Development, OAFLAD-GAVI Alliance, the Vaccine Alliance, UICC, the NC Alliance, and we're very happy to be graced with the presence of the First Ladies from Africa. The First Ladies, we respect them, we love them, and they are doing amazing work behind the scenes by mobilizing government, but also making sure they're creating and raising awareness around girls' health. Today we have, the meeting will be chaired by Excellency Madam Oxila Mangadwa, First Ladies of Republic of Zimbabwe, and the Vice President of the African First Ladies of Development. So we would like to welcome the First Ladies of Angola. Your Excellency, welcome. Botswana, please welcome. Burundi, Central African Republic, Gambia, Zambia as well. Welcome tech advisors representing our First Ladies. The meeting is a follow-up from the Health Organization, from the Health Policy Commitment 2020 Cervical Cancer Elimination. We need to make sure we understand what cervical cancer does for boys, for girls across the world. It's a global action plan adopted with universal support. We are calling, it's also for call for action for the 2018 UN Hunger Cervical Cancer event and 2016 call for action immunization, which led to the above. And so I wanted to mention the active roles the First Ladies are really doing right now across the world to make sure they're getting advocacy at a continental, also at a global level. I was lucky to be at the United Nations last year when I met so many African ladies pushing for the health of girls across Africa. We also would like to drive the regional conversation. As Africans, it's important that we educate our people to raise the awareness around cervical cancer as well. We need to also have effective action today to understand the need to build around the girls and women, the environment, and empower them to take action for their own health. Like I said, when a young girl and a young woman is healthy, the whole community, the whole world is also healthy. We also will look into girls, and as our advocate, we have amazing young girls advocate who are joining us on this call. We'll give them the floor so they can also share their stories. We also will look into decision makers, doctors, and scientists who will be on this call. So thank you so much. Welcome again to the virtual event for the International Day of the Girl Child 2020. Why girls' health matter now more than ever. So it is my pleasure and honor to welcome Her Excellency, Madam Oxila Mangwa, the First Lady of Republic of Zimbabwe. Your Excellency, please let us have your opening remarks.
Thank you very much. Your Excellencies, distinguished participants, ladies and gentlemen, let me start by welcoming you all to the virtual event to celebrate the International Day of the Girl Child under the theme, Why Girls' Health Matters Now More Than Ever. The event is organized to commemorate the International Day of the Girl Child with a focus on the girls' health and well-being, particularly the cervical cancer. The event aims at creating a platform to share experiences on cervical cancer screening and treatment and HPV vaccine and reflect on the importance of the cervical cancer elimination strategy to ensure the well-being of the girl child. This year's global theme adopted for the International Day of the Girl Child is My Voice, Our Equal Future, which is a reflection of the commitment to imagine a world where girls feel recognized and empowered. Investing in adolescent girls' health is of paramount importance in enabling them to express themselves. It also is a reminder to listen to girls and involve them in decisions that affect them now and in the future. To listen to their call, to be understood and understand, and the changes they want to see so that they have an equal opportunity for a bright, safe, and healthy future. African First Ladies have been advocating for the African girl child's right to have access to health services. We have been advocating for the increase of the capacity of the health sector to be able to provide adolescents and youth-friendly health services across the continent, with focus on girls. I have been calling for the services to improve health outcomes among adults and young women. African First Ladies, through their national programs, have been able to raise greater public awareness about prevention, early diagnosis, and treatment options for cervical cancer. Cervical cancer, which affects millions of women and kills as many as a quarter every year, is one of the preventable diseases. Yet it remains the most common cause of cancer death among women in Africa. OAFLAD 2020 annual theme, Gender Equality and Women Empowerment, a pathway to the Africa we want, is a reflection of African First Ladies' concern in keeping the agenda of the African woman at the forefront. They have vowed to mobilize African governments and global support for prioritization and funding for the prevention, early diagnosis, and treatment of cervical cancer. African First Ladies advocacy is not limited to the continent. At the global level, OAFLAD organized a panel discussion in the margins of the 73rd UN General Assembly in 2018, where a white paper on the state of breast and cervical cancer in Africa was released in collaboration with the WHO, AFRO, and the African Union Commission. Following this event, country-level workshops on breast and cervical cancer have taken place in Ghana, Kenya, and Zambia upon the initiative of the respective First Ladies. Distinguished guests, the COVID-19 pandemic and restrictions on movement have elevated risks for girls to be violated, abused, and neglected. The number of gender-based violence cases has increased since the onset of COVID-19 in a number of countries. Evidence from past experience with epidemics indicates that resources are often diverted from routine health services, which further reduces access of many girls and young women to basic sexual and reproductive health services. COVID-19 has now become the pandemic that is restricting women and young girls' access to their health rights. The COVID-19 pandemic is exacerbated the gap in the healthcare, including a decline in HPV vaccination availability rates. At present, however, as we near the time where students are going back to school, efforts should be made to reach out to more adolescent girls to receive the HPV vaccine. A more collaborative effort needs to be put in place among various stakeholders in order to build the momentum once again with regards to ensuring adolescent girls receive the HPV vaccine in due time. Girls are harder to reach once schools are closed, particularly those living in the rural areas. Education provides a girl with the opportunity to build a better life for yourself and will feel empowered and protect against violence, exploitation, and social exclusion. School closures have already caused millions of girls to miss out on their education and millions yet never to return back to school. Schools are not only places for the young girl to thrive, but also a place where they can be reached for basic health services, including HPV vaccines, which offer long-term protection against cervical cancer. Prevention through vaccination is also one of the strategies adopted by the World Health Organization, which proves to be effective, efficient, and long-lasting. African First Ladies have been promoting the HPV vaccine in their respective countries and advocating for adequate access. At this critical time, however, collaboration in promoting HPV vaccines should be a priority among various stakeholders. Girls have voices and can be powerful agents of change, and their potential should not be undermined. We should join efforts to fight the challenges that keep them from participating fully in all areas of life and dedicating adequate resources for girls to fulfill their full potential and their rights to health services respected. I'm encouraged that by today's event, and I trust that we will continue to engage and forge on a shared goal to address the emerging obstacles facing women and girls in African and indeed globally. I thank you.
Thank you so much, Your Excellency. That was really amazing. Thank you so much for your opening remarks. We really appreciate you. Thank you. Well, part one now is how to build the high-level momentum, and I will let Your Excellency, Madam Brigitte Touadéra from the Central African Republic to give us her remark. Your Excellency, welcome.
En République centrafricaine, les maladies non transmissibles constituent une priorité du gouvernement, sont principalement les maladies cardiovasculaires, le diabète, le cancer, les maladies respiratoires chroniques obstructives, les accidents de trafic routier et la drépanocytose. Les facteurs de risque de ces maladies répertoriées au cours d'une enquête nationale en 2017 sont entre autres la consommation de tabac, soit 7,9%, dont 1,3% chez les femmes, et la consommation nocive d'alcool, soit 49% chez les femmes. Une est réalisée à Bangui sur une période de 10 ans allant de janvier 2006 à décembre 2015. Cette étude a montré des pics de fréquence de diagnostic en 2006 et en 2015 avec les extrêmes de 63 cas et 112 cas. 88 cas de cancer par an. Le sexe féminin prédomine dans une proportion de 63%. Chez les sujets de sexe féminin, sur 550 cas de cancer, l'appareil génital féminin prédomine avec 323 cas, soit 59%. La Fondation Cri de cœur d'une mère œuvre dans le domaine de la santé de la reproduction maternelle, néonatale, infantile et des adolescentes, y compris l'infertilité et la lutte contre le VIH et le sida. Les actions de la Fondation Cri de cœur d'une mère sont développées en vue de répondre d'une manière générale aux détresses des filles, des femmes, des mères et des familles dans le domaine de la santé de la reproduction. Le renforcement des capacités, mes principales contributions dans la lutte contre les cancers du col, de l'utérus et ceux du sein sont les suivantes. Le renforcement des capacités des jeunes en général et des adolescentes en particulier à travers la formation d'une centaine de pères éducateurs et éducatrices et la sensibilisation des jeunes et adolescentes à travers l'organisation de conférences et la vulgarisation d'un dépliant sur le cancer du col et du sein. J'ai été impliquée dans le programme de Merck intitulé Blue Point, qui m'a permis d'envoyer en formation en Inde dans le domaine de l'oncologie un médecin gynécologue obstétricien. La durée de formation est d'1 an. Les dispositions sont en train d'être prises avec ce médecin pour la mise en place de structures pour le dépistage en masse des filles et jeunes femmes en collaboration avec le ministère de la Santé. Le nouveau plan triennal de la Fondation s'inscrit d'une part dans la dynamique des actions des Premières Dames d'Afrique et d'autre part dans la mise en œuvre de la vision de la Fondation en accordant une importance particulière à la promotion de la santé de la reproduction auprès des jeunes et des adolescents. Le plan stratégique 2019 du plan d'action lutte contre les maladies non du plan est consacré au renforcement des capacités du pays dans le diagnostic et la prise en charge du cancer de l'utérus, du col de l'utérus et du sein, des fistules obstétricales et de l'infertilité dans la prévention, le dépistage et la prise en charge des maladies non transmissibles. Nos actions seront axées sur la sensibilisation de masse contre la consommation de différents produits nocifs pour la santé, alcool, tabac, et la promotion de la consommation modérée des aliments, sucre et sel. Le plaidoyer auprès des firmes pharmaceutiques internationales pour l'approvisionnement des hôpitaux en médicaments, pour la prise en charge des MNT par le ministère de la Santé et sur l'introduction du vaccin contre le papillomavirus. Le plaidoyer auprès du ministère de la Santé pour l'identification de 5 médecins par an pour la formation en cancérologie, toujours avec l'appui de Merck Fondation. La promotion du dépistage précoce des lésions précancéreuses chez les filles et chez les jeunes femmes. Ma participation à ce webinaire a un double intérêt. Partager avec mes sœurs, les Premières Dames, les actions que je développe depuis environ 5 ans pour la promotion de la santé des femmes, des enfants et des adolescents. Ensuite, m'imprégner des bonnes pratiques de mes sœurs en vue de les répliquer dans mon pays. Le défi à relever pour la prise en charge adéquate des cancers réside dans la disponibilité des ressources humaines qualifiées et des intrants nécessaires au diagnostic et à la prise en charge médicale des patients. Un autre défi de taille est l'introduction du vaccin contre le papillomavirus dans le programme national élargi de vaccination. Malgré les efforts entrepris au cours de ces dernières années pour la promotion de la santé de la reproduction et la lutte contre le cancer du col de l'utérus, le système de la santé de la République centrafricaine demeure confronté à un déficit important d'infrastructures et équipements, les problèmes de gestion des intrants et médicaments, une pénurie en ressources humaines et une insuffisance de financement de la santé. Promouvoir la santé des filles et des jeunes femmes constitue l'un des objectifs importants à atteindre pour le développement d'un pays. Je vous remercie.
Merci beaucoup. Merci beaucoup, Son Excellent. Nous vous remercions vraiment beaucoup pour ce que vous avez dit. Merci beaucoup. Merci, Madame. Merci. Merci. Okay, so we'll switch back on English. I would like to welcome, before we move forward, Your Excellency, the First Lady of Sierra Leone and the First Lady of Eswatini. Welcome, Your Excellency. We are really happy to have you with us. Now, I would let Your Excellency Esther Lungu from Zambia to give us her remark. Welcome again, Your Excellency. Welcome to this webinar. Thank you so much for being here.
Very much. May I ride on the protocols that have already been highlighted by my dear sisters in the interest of time. Excellencies and distinguished partners, I am delighted to join you in this virtual meeting to celebrate the commemoration of the International Day of the Girl Child 2020, depicting why girls' health matters now more than ever. I am aware that this is not the traditional way OAFLAD has held its meetings all along. However, these are hard times requiring innovative ways of doing business in order for us to save our lives as well as the lives of those around us. The COVID-19 pandemic has not spared any country, and therefore, as First Ladies and global partners, we must continue to sensitize communities on this deadly disease. I am honored to be part of the panel to discuss the health issues affecting women and girls in my country, especially with regards to cervical cancer. Excellencies and distinguished partners, Zambia has a population of 18 million people, with 66% below the age of 24 years and a median age of 17 years. We have a young population that needs a lot of support and empowerment in order for them to be aware of the issues around them that will determine their well-being. Distinguished ladies and gentlemen, this afternoon I want to look at cervical cancer elimination through the gender lens and how adolescent girls can influence this agenda. Gender is a known and important social determinant of health. Adolescent girls are saying, "My voice, our equal future." We must encourage them to seize the opportunity to be inspired, to create the social change they want, so that they are empowered to live free from gender-based violence, harmful practices, HIV and AIDS, and indeed cervical cancer. This is only possible if we teach them new skills so that they become leaders in a generation of activists accelerating social change. This is the only way that girls and women can become empowered, to have freedom to make decisions, and also access economic resources and healthcare services. Cervical cancer is the most common cancer in Zambia, accounting for 24.8% of all new cancer cases. It is also the leading cause of cancer-related deaths in Zambia, although it is known to have effective prevention strategies. In Zambia, investments in the cervical cancer elimination agenda have been made. Currently, we have one, an HPV national vaccination program that started in July 2019 as part of routine immunization targeting adolescent girls aged 14 years. Two, we have a national cervical cancer screening program that has covered 105 out of 117 districts in Zambia. And three, We have a comprehensive cancer treatment center for those found with cancer, with plans to construct 2 more centers in order to increase access to treatment. Distinguished ladies and gentlemen, despite having made the great strides, Zambia still has challenges in ensuring that these services cover the targeted populations, especially those in rural areas. Distinguished ladies and gentlemen, the Esther Foundation Trust aims to have economically healthy and socially empowered communities in Zambia. Further, my foundation seeks to reduce vulnerability of the poor using gender-sensitive, participatory, and environmentally sustainable approaches to improve their livelihoods through various social projects such as advocacy on ending early marriages and sponsorship of girls into primary and secondary education. Specific to cervical cancer elimination promotion, our interventions include advocating for the young people across the country to become aware of the opportunities that exist for cervical cancer elimination so as to empower the girls to begin to demand for such services as girls of today and workers, mothers, entrepreneurs, household heads, and political leaders of tomorrow. Furthermore, my foundation has engaged traditional and religious leaders to facilitate education of communities on cervical cancer screening using the village-based screening model. This approach has seen over 80% of women accepting screening after the educational talks on cervical cancer. My foundation also advocates the elimination of child marriages. As First Lady, I remain a champion for HPV vaccination advocacy for adolescent girls in Zambia. Additionally, WHO supported the M Cervical Cancer Initiative that I launched in 2016, making Zambia the first country to leverage existing mobile technologies to improve health outcomes through SMS messages sent to women eligible for screening. This has translated in a 6% increase in the uptake of utilization of the cervical cancer screening services. With support from Roche through OAFLAD, the Office of the First Lady held the first high-level private sector engagement meeting early this year on cervical and breast cancer. These attracted over 200 participants from civil society, aviation, financial institutions, military, insurance companies, government institutions, and business houses in order to galvanize support for cervical cancer control. Distinguished ladies and gentlemen, in conclusion, elimination of cervical cancer calls for us to go beyond the health sector in understanding the risk factors of cervical cancer. We must begin to address the social, political, and economic determinants of health in order to eliminate cervical cancer. I thank you all.
Thank you so much, Your Excellency. It's really amazing to hear all of these amazing ideas and how we're actually building high-level momentum in Africa to make sure the life of young girls are taken care of. Thank you so much, Your Excellencies. We really appreciate you, the First Ladies of Africa. Thank you so much. Before we go on the video, we have a video we would like to show you in few seconds. I think I just would like to give you few components on what we discussed. I think what is really important, what we heard, is that the First Ladies are taking action. The First Ladies really care about the health of young girls across Africa, and they know the health of young girls matters. So as we celebrate today and we work together for this virtual event, to make sure that the health of girls matters, I want all of you to join me to thank so much again, Your Excellencies, for coming on this virtual event and for giving your remarks. So let's now look at the video of cervical cancer elimination strategy.
This is a call to action to eliminate cervical cancer. We're losing a woman every 2 minutes, and this should not happen, especially when we have all the weapons we need to fight it. So this is actually a cause that's winnable.
I went for doctor checkup and found out that I have cancer.
I almost didn't engage with it for a while because it felt like I couldn't be a cancer patient at 26. I was so young.
The doctor said she'll call me after a week. She called me and she informed me that I'm diagnosed with the cervical cancer stage 2B.
The most recent data, which just came out, showed that the current incidence rate is 570,000 women every year. And that we're now hitting 300,000 deaths every year from cervical cancer.
But cervical cancer is indeed both preventable and able to be diagnosed early. And so you see this incredible contrast between countries like Australia, who are set to eliminate cervical cancer as a major health program, versus low-income countries where there's just no effective services at all.
Just imagine that a patient who is just 25 years old all of a sudden presents with bleeding, and you know the patient is going to die.
9 out of every 10 women that die of cervical cancer are from low and middle-income countries.
You are trained to save lives, but most of your patients are dying within 6 months.
It's also an issue of gender and social equity, because we know that the poorest women are most vulnerable.
The doctor read through the results. That's when I was told that I had cervical cancer. I must tell you, that was the worst day of my life, because just to be told that I had a cancer, to me it was almost like a death sentence. It robbed me of all my happiness, all my life. It was just terrible.
64% of women in Zambia live in the rural area, and 80% of the women that are living in the rural area are producers of food. You're going to lose women who can contribute to ensure that this nation is a better nation from a disease that we could have prevented. That is why we need to ensure that this disease is eliminated.
What I think is great about the call to elimination is the targets that they've set. Firstly, to look towards 2030, so a 10-year horizon.
If we can deliver 200 million doses of vaccine in 10 years, we can immunise the whole population over the next 30 or 40 years and reasonably expect that within my children's lifetime, we'll have no more cervical cancer.
If we can achieve successful scale-up of HPV and cervical screening and vaccination, the evidence suggests that we could prevent up to 13 million cervical cancer cases in the next 50 years.
Cervical cancer can be beaten if we come together. Early detection saves lives, but the message out there, prevention.
We have the vaccines, we have the diagnostics, and we have the treatment. When we have all the weapons and failure should not be an option.
Wow, that's really amazing. I mean, I am scared of cancer, and many people are scared of cancer. But I think what we saw today, we build the momentum, and now it's time for us to look into cervical cancer strategy and who are the best people to talk to us about the strategy the world is taking for girls to have a good health. And I'm very pleased and honored to introduce Dr. Princess Nothemba Simelia. She's the Assistant Director General for Family, Women, Children and Adolescents from the W Health Organization. Welcome, Madam.
Thank you very much for the kind welcome, and may I acknowledge the presence of the excellencies on this webinar. Thank you so much for an opportunity to share the work that WHO is doing on behalf of all of us, because the strategy is a global one. It's led by WHO, but it's for everybody around the world, all the institutions that work on global health and our partners. You play an incredibly important role, because raising awareness, as I heard one of the first ladies say, and educating young girls about the different diseases that are out there that can impact on them are very important steps in achieving elimination. So we have this strategy now, which has been really a work that has involved the research community, the modeling community, academia, activists on the ground who were very clear about the things that are needed to increase access to services for screening and treatment. So after the call made by the Director General, we put these partners together, and the World Health Assembly, which is 196 countries across the world, has now adopted this strategy, which is going to now be implemented by all the countries. The strategy focuses on 3 important areas. It emphasizes the importance of prevention, making sure that young girls get the HPV vaccine before they turn 15, because we do know that exposure through sexual activities raises the risk of acquiring the high-risk HPV. We also know that, unfortunately, for our communities, women living with HIV have a very high risk, 6 times at risk to get high-risk infections, and they get the infection at an earlier age, and it rapidly progresses to advanced cancer, and we lose the women in spite of having been able to treat the HIV infection. So we have to really fight hard on the sub-Saharan continent, on Africa generally, but sub-Saharan Africa is hardest hit. The numbers that the Excellency referred to, a woman dying every 2 minutes, are very, very high. So we really have to focus. The second part of the strategy focuses on screening and treatment for women who have early changes on their cervix, which indicates cervical cancer. The nature of this cancer is almost sad because it takes up to between 8 and 10 years before you get full-blown cancer, which is enough opportunity for us to go out, encourage women, find them, and screen them. If we really invested on this second pillar for the population of the women who should benefit, which is the age group that is beyond the 15 years of age, and any time from the childbearing age, 30 and above, 26 and above, we want women to be screened because there is enough opportunity to cure these smaller lesions and to ensure that we don't get cancer. The third part of the strategy focuses on an area that is almost two-sided. We are saying 90% of the women who are screened and found to have early lesions must get access to treatment. And we have now new technologies, handheld tools that can remove these early lesions, which is a great advance away from the big, bulky gas tanks that were required for thermal coagulation. So now we've got these devices that need just a battery to be operated, and you can do a screening on the same day and treat the women on the same day to just cut down on the loss to follow-up. The second component of that last 90% was saying women who already have advanced cancer, 90% of them must receive care. And this care must include access to pain management. We know a lot of our countries don't have access to pain management. The drugs are expensive, and we don't have enough. So women die in severe pain, and we are arguing that it is a human right to not face a painful death. And we hope that more and more work will be done. We hope that through your advocacy and your leadership, our governments will really pay attention to this And the argument we are placing as well is that when you address cervical cancer, when you invest in the hospital infrastructure, you're going to benefit other cancers as well. It's not as if everything that is going to be done will just benefit the women. Even men with prostate cancer and other cancers, these machines can treat all sorts of cancers. So it's a good investment. We've shown that it's the best buy. If countries invest in this, the return on investment to society is amplified in many, many ways. So we are now promoting this strategy. We are happy that it's been adopted. On the 16th of November, we will formally launch it and make it available to as many people as possible. But what is important is not the document, it is whether countries can have access to the tools that they require. So we need driving demand at the country level through the work that you are doing as First Ladies, get more women's organizations involved, get the church community involved, get the education sector involved, let the people know about cervical cancer. And then we are saying, let the countries have access to the tools. And we're negotiating with the manufacturers for lowering the prices. The COVID pandemic has shown that Africa can actually manage with laboratory infrastructure. So this whole argument about our systems being weak has been changed, because we can show, we can screen people, we can test, and the same platforms that are being used to test for COVID-19 can be used to test for HPV infection. And we also then want to make sure that we have enough nurses and doctors trained to then manage women who've got advanced cancer. So this is our call, and we're also saying the inequities. Developing countries have everything, and this is demonstrated in the second slide that I wanted to show. There are two other slides that I wanted to show. If you look at the map, you can see the darker red is where you have the highest number of women who have cervical cancer and who die from this disease. Now, if you move to the other slide that I wanted to share, is a third slide. I hope you've got it. Yes. This is a slide that then shows you where HPV vaccine is available. And you can see the contrast. The dark pink in the area graph was mostly in Africa. Now you see in Africa, the green has now suddenly moved to the Americas. And these are countries where we've got vaccine for girls under the age of 15. But that's not where the problem is. That is why we're arguing this as a human right, as an inequity that the world has to address. It must be very shameful for the world to see this. Where the problem is, we don't have the vaccine. We must advocate, Excellencies, that this picture must change, that the green must be across all of Africa. All the young girls in our continent must have the vaccine, and all the other things that we need for treatment. I just wanted to show those two slides which show the inequities. Where people are dying is where we have no access. And we must argue, we must fight, we must advocate. Because if we address this, many other illnesses that kill women that can be prevented will also benefit. I thank you for this opportunity to share this work and invite you to continue to support us in this call for elimination. The world can do this. We cannot shy away from this issue. It's time to confront it. Thank you very much for having supported us and for walking this journey with us. I commit the support of WHO to the work that you're doing now and into the future. Thank you very, very much for this opportunity.
Thank you so much. Thank you so much, Doctor. Thank you so much, Doctor. I have one single question for you. We are running out of time, but I'm sure everybody would like to hear from you. What is the vision and goals for the cervical cancer elimination strategy, and why do you think this is so significant right now? And what is the World Health Organization doing to address this very specifically?
The targets for the strategy. I mean, the vision is a world without a cervical cancer. This is the first time that the World Health Organization has called for the elimination of the cancer. This is a cancer that can be prevented with an HPV vaccine, and it can be cured if we find women early. This is what is unique about cervical cancer. That is why we feel that this initiative is special and deserves the attention that we are calling the world to do. We don't have many cancers. In fact, I cannot think of one that is preventable and curable. So that's why we believe that the strategy is important. The goals, the targets, we're saying 90% of girls in the right age group must get the vaccine. Because if we do this, in 2 decades, we will actually not be talking about cervical cancer, because these young girls will grow up being protected from this infection. 90% of the girls, and we're saying 70% of women in the age groups that are important. In the women who are living with HIV, research will come out at the end of the year to indicate at which age we must start screening, but otherwise, from the ages of 30 and above, we would like to see women being screened at least twice with a test that is really appropriate to make sure that we diagnose cervical cancer. So WHO, like I said, we've got the guidelines out for countries. We're advocating now for reduction of the costs of the screening and treatment tools. We're engaged in research where we are trying to see if we can use technology that is artificially intelligence-driven, where the nurses can just take a picture of the cervix and there is an algorithm that can diagnose in the cell phone itself. So we can do same time screen and treat, and with the research we're doing now, you can actually get a diagnosis within a space of between 5 and 10 minutes with that picture. And because cell phones are available in the greatest part in our continent, we believe that these tools, once research has proven that they work, will really take us to the next level. So these are the things that WHO is doing right now. At the moment, we are supporting a number of countries in Africa with some resources, with training, and with people on the ground. We got disturbed by COVID-19, and we are very, very despondent, but we are very excited now that things are looking a little bit better on our continent, and we want to emphasize that it's not important to set up a standalone cervical cancer screening program. We can use family planning clinics, we can use HIV clinics, we can use delivery, antenatal care. So there are many, many opportunities that we would like to promote, and we want to work, as I said, with as many partners to make sure that we achieve the goals set out in the strategy. So that is what we are doing in study.
Thank you so much. That's wonderful. Thank you so much. I as a technologist, I'm very, very hopeful. I'm very hopeful. I live and breathe technology, so I'm very, very hopeful. Thank you so much. Thank you. Right, so we are moving forward. Thank you so much. We're moving forward with a video intervention with GAVI Alliance. Thank you so much. And we will have Miss Anuda Gupta, Deputy Chief Executive Officer for the GAVI Vaccine Alliance.
I would want to thank the First Ladies of Africa for being such great champions of women and girls, of being such a great champion of GAVI and our work, particularly on HPV vaccine. This year's theme for the International Girl Child Day is a very apt one. My voice, equal future. It is the First Lady's leadership that is bolstering the voice of the girls and the women, and would definitely pave the way for a very equal society in future. At GAVI, we are so passionate about gender, about making sure that both girls and boys have equal access to vaccines, and making sure there are no gender-related barriers in terms of immunization. Whether it is our health workers who are predominantly females, or adolescents, or girl children, or caregivers who happen to be female, the new gender policy that GAVI has recently launched tries to ensure that we understand the needs of each of these groups and make sure that we identify gender barriers in time and proactively invest in addressing them.
So what has been the impact of COVID-19 on girls' access to health services, particularly access to the HPV vaccine?
The pandemic upended the whole world and everybody's life, but it has disproportionately impacted women and girls. A lot of girls are now out of school. Many of them would not be able to go back to school. Many are getting married as children. The number of teenage pregnancies is on the rise. Women are unable to access skilled birth attendance and antenatal care services. They're increasingly becoming victims of domestic violence. So really a very, very worrisome picture for girls and women. And this is therefore the time for us to focus more and more on making sure girls and women are supported, their health needs are understood and addressed. So far as HPV vaccination is concerned, GAVI is off to a very good start. In the last strategy period, we have seen 18 countries introduce HPV vaccine. The coverage in most countries is reasonably high. 5 million girls have already been reached. Our goal is much more ambitious in the years to come. We want to reach 84 million girls in the next 5 years. For now, the pandemic has impacted both the introduction of HPV vaccine in GAVI-supported countries and also the delivery of HPV vaccine where it is already introduced. But we are trying to support countries as much as possible to restore immunization services because they are so critical to children and girls, and also help countries move forward with introduction of this critical vaccine. As a result, we have seen there are countries that are able to introduce HPV vaccine, like Laos did it very recently, and they took a community-based, health facility-based approach because in many cases schools are closed and girls are unable to attend school. We also have Myanmar and Cameroon that are now preparing to introduce HPV vaccine before the end of the year. So overall, we stay very optimistic that we would continue to work with countries to make sure that this important HPV vaccination program does not receive a setback in the wake of the pandemic.
What type of interventions is GAVI supporting at country level to improve girls' access to healthcare?
So there are really two ways in which GAVI is trying to bolster the health of girls and women in countries that we support. The first one is through vaccine programs that directly benefit the health of girls and women, such as HPV vaccine, which we know is a very effective vaccine. It protects women against cervical cancer and related mortality. At this time, we have more than 300,000 women die every year because of cervical cancer. And most of these deaths take place in developing countries where facilities for timely screening are weak. And in case of cervical cancer, many families cannot afford the high cost of treatment. So by scaling up HPV vaccination program, we are trying to ensure that women receive the protection that they need, that women do not die in the prime of their youth. They do not leave behind young children and infants, because we know that the economic and social costs of mothers dying or women dying because of cervical cancer are very high. Another very important way in which we are trying to bring attention to women's health issues is through our work on zero-dose children. Zero-dose children are those children who do not receive even one single shot of most basic DTP vaccine. And as we start to identify zero-dose children, we know that 2 out of these 3 children live in the poorest households, families that subsist on less than $2 a day. But we also see that these families are suffering from multiple deprivations. 50% of zero-dose have mothers who have not received antenatal care or skilled birth attendance or contraception. And therefore, by shining light on zero-dose children and trying to immunize them, we want to also heighten awareness about the plight of women in these settings and communities, so that it is not just immunization that reaches them, but a whole host of other services women need are also provided.
Over the next 5 years, how will GAVI ensure that all children, including those from marginalized communities, have access to vaccines?
So I just touched on the concept of zero-dose children. For us, a child who has not received even a single dose of DTP vaccine is a marker of acute inequities. They represent those communities that miss not just immunization, but all other services, be it water, sanitation, nutrition, or reproductive, maternal, newborn child health services that I just alluded to. So really, going forward for the next 5 years, we are extremely focused on reaching these zero-dose children. And we know that this is going to be a very complex and daunting task. So our first step would be to identify these communities where zero-dose children live. We are making a lot of investments to understand what are the geographical areas where these children live, whether they are urban slums or remote rural areas or conflict settings, or they live in places where services are already available, but because of certain other barriers, they are unable to access those services. So really understanding where these children are and how many are there, because we also find that children are missing services in low coverage areas where populations are sometimes very sparse, but they also live in highly populous areas where service coverage levels are typically very high, and yet the number of unreached children can also be quite large. Having understood where these children live, the next step for us to understand is to see who are these children and why they are being missed by immunization services. So really getting into the barriers that these children face. And that is where gender-related barriers from our perspective are very important, because in a lot of cases we have seen that women are facing a variety of difficulties in bringing their children for immunization. Sometimes women are too busy with their household chores. Sometimes they don't have the authority, authorization, money, or time to travel to the facility for immunization. And sometimes they are out doing work at a time when the immunization session is offered and are simply too poor to be able to forego their daily wages, and therefore are unable to bring their children for immunization services. So we are unpacking all these drivers of inequities, including gender-related barriers, to see how we adapt our services to suit the needs of caregivers, particularly mothers, so that they are not inhibited in bringing their children to immunization services. Another very important part of a strategy is to also get men and fathers into the conversation and make sure they also understand the importance of them sharing child rearing responsibilities, so that they can also play a part in bringing their children for immunization and making sure that children receive the full range of vaccines that they need. A lot of our work now is going to be at subnational level, and therefore our attention and resources would be focused on looking at communities, provinces, districts where unserved, unreached populations live, and then making sure that we provide countries the required health system strengthening support and also technical support, but we also help countries with a lot of innovations. For example, how do we do data triangulation to understand where these children are? How do we take supply chain to those remote areas where there is no electricity to support cold chain? How do we use digital health to also motivate caregivers to bring their children for immunization services and give them timely reminders about the date when they have to bring their children? So a lot of work is there to happen in the next 5 years, which would focus on women, gender-related barriers, and making sure that the most marginalized and vulnerable communities are identified, that the barriers are understood, and then strategies are worked out to reach them effectively, not just with immunization, but also a range of other services that these communities need.
Thank you so much, GAVI Alliance. We love GAVI Alliance. Thank you all the work you've been doing to help us with vaccine across the world. This is my favorite part. I have girls advocate, amazing young girls, 2 of them, one from Zambia, one from Ethiopia. I love working with girls and really listening to what they have to say, because at the end of the day, we need to make sure everything we're doing is serving young girls. So I've got someone to introduce. I need to introduce my guest from Ethiopia. Her name is Kaligan. She's 15 years old and is in the 10th grade. She learned at, I don't know how to pronounce the name of the school, but she's in a secondary school. And Kalkigan has been a cast member of the Yegna movie series since she began the show. She also worked and participated in theaters and providing education to kids regarding health, education, and all of that. And she got a Facebook page as well. You can go and check her Facebook later. It's facebook.com/Yegna. Yegna, how are you doing? Kaligan, how are you doing? Can you hear me? Are you there? Okay, I can see you. How are you? Good. Well, I've got a couple of questions for you. First of all, welcome to our virtual event. It's your event. My equal rights and all of that is all for you. So I've got a couple of questions. What motivates you to go and get vaccinated for HPV? And why health is so important for young girls like you? Can you share with us?
Hi, Kalkidan is going to be speaking in Amharic, in the local language. After she speaks, I'll be doing the translating, okay?
Fantastic, no problem.
So let's hear her first. Okay.
በመጀመሪያ ለ13 ዓመት ነበር የመጀመሪያ ክትባት በሚመጣበት ጊዜ እና ከዛ በኋላ ልክ ዘንድሮ በእኛ ድራማ ላይ ስለ ክትባቱ ብዙ እውቀትን ካገኘሁኝ በኋላ ትምህርት ቤታችን በመጣ ጊዜ ተከተብኩኝ ማለት ነው የመጀመሪያው ዙር ክትባት።
Okay. I was 13 years old. At first, I was hesitant because I didn't have enough information through my calendar. I didn't have enough information, but through my character in the Yenya TV series, I learned about HPV vaccine. And in the drama, I played a girl who advocates for girls to get vaccinated. From the character, I played all the information was available, which helped me understand about HPV vaccine and its benefits. Wow. After a while, when the doctors came to my school, I was the first in line to get vaccinated.
That's amazing. That's really incredible. I love when young girls take action. And my second question to you is, what are the most challenging, what are the most challenging things in accessing health services in your area, in your knowledge? What are the challenges? Can you share with us the challenges you have, for example, in going and picking up the vaccine and all of that? Can you share a little bit of the challenges you have?
ቫክሲኑ ምንድን ነው? ስለ ቫክሲኑ ነው የጠየቅኩት።
በመጀመሪያ ለወላጆቻቸው ቶሎ ለመናገር በወላጆቻቸው የሚረዷቸው አይሆንም። ማለትም እነሱ እንደ ቀለል አድርገው ነው የሚያዩት። እንደ ቀለል አድርገው ነው የሚያዩት። ማለትም ምን እንደተሰማቸው በዛ ሰዓት ሐኪም ማግኘት እንዳለባቸው አይረዷቸውም። በሕክምና ቦታ ላይ ደግሞ በደንብ ግልጽ ሆኖ እንዲያወራቸው የሚሰማቸውን ነገር ወይም ደግሞ ስለ በሽታቸው እንዲያስረዱ ግልጽ መሆን ችግር ነው።
Okay, health is important to follow learning in a successful and active way, to be active in any kinds of social interaction we have. Families, families don't understand the variance of their sickness. They don't properly discuss with their parents on how they feel. Lack of understanding from the parents regarding the pain she is going through. There is no comfortable, youth-friendly health service considering the age group.
I do totally agree with her. I work with girls across the world, and I think my last question, which is really important today with COVID-19, over 1.1 billion young girls don't, have access to education. So I would like to know, what do you think about COVID-19, and how are you coping as a young girl today with COVID-19? Would you mind sharing with us?
አማርኛ ስፒከር ስላለ በኮቪድ ጊዜ በእረፍቱ ብዙ ነገሮች እየተፈጠሩ ነበር። ማለትም እኛም ብዙ ነገሮች እየሰማን ነበር እና የአካላዊ ጥቃት፣ የሴቶች ጥቃት ይከናወን ነበረ እና በዛ ጊዜ እኛ ቤት በምንሆንበት ጊዜ ማለት ራሳችንን በምን ሁኔታ መጠበቅ እንዳለብን እንደዚህ ነገር በጣም ያሳቅቅ ነበረ። ማለት ምን አድርገን ነው ከዚህ ነገር ራሳችንን መከላከል የምንችለው ብለን በጾታዊ ጥቃት ዙሪያ በጣም እንፈራም ነበረ። እኔም ጓደኞቼም ቢሆን በምን መልኩ ከዚህ ነገር መቆጠብ አለብን እንል ነበር እና ደግሞ ከዛ በተጨማሪ በዚህ በእረፍቱ ጊዜ እኔም ሆነ ጓደኞቼ የትምህርት ቤት የቴሌግራም ግሩፖች አሉ። እዛ ላይ ወርክሺቶች ወይም ደግሞ ልንሰራቸው የምንችለውን የባለፈው ዓመት ትምህርቶችን ጥያቄዎች ይሰጡን ነበረ። እናም ከዛ በኋላ እኛሱን እንሰራለን። እንዲሁም ደግሞ የራሳችን ተሰጥኦ ለማሳደግ የምንችላቸው ነገሮች ሁሉ እንሞክራለን። ድምጽ፣ መጽሐፍ ማንበብ ምናምን።
Okay. COVID-19 has brought lots of challenges for young girls and boys in Ethiopia. There is an increase in gender-based violence, which in turn has a negative emotional distress to me and my friends, which made us afraid of what's going to happen. I mostly cope with reading books, writing poems, watching talent shows, and working on my vocals. My friends in my community spend their time by doing worksheets in our school Telegram groups and helping out in domestic works.
Well, I am personally very proud of you, and I'm sure I will go and show your Facebook to my 25,000 girls all across the world. Congratulations, and keep going. Keep going. Okay, now the next guest is from Zambia, same girl, 15 years old, and her name is Nambela Nashi Yango. I hope I pronounced her name correctly. Please forgive me. So she's a 10th grade at a high school in Lusaka, Kambulonga. I need to give a shout to your school. She's a VIP, vaccinate, immunize, and fought against HPV. So congratulations, welcome to the virtual event. And I've got the same question for you, really. I've got the same question for you. So maybe let me stop there. You can say hello before I ask you the questions. You want to say hello before I ask you the questions?
Hi, everyone. My name is Nambela Nachilyango, and I'm 15 years old from Zambia.
Well, welcome. So again, it's the same question I just asked to your Ethiopian friend. What motivates you to go and get vaccinated for HPV? You know, when I was growing up, I didn't know what HPV means, and I'm sure my girls in Kakuma refugee camp in Kenya don't know about it, but I'm definitely going to tell them. So what motivates you? Can you share and tell us why it's important for young girls to do this?
I was 9 the time that I got the vaccine, and so everyone else, my friends were doing it, and so I wanted to join them because I was small, just follow what everyone else is doing. And my grandma also pushed me to get the vaccine and said it was safe, and it also mattered for my health. It was very important for my health for me to get this vaccine.
That's really wonderful. I mean, that's why I love what GAVI and WHO are doing, and all of the first ladies, everything they're doing across Africa is really fascinating. So, and my next question is, you know, I know that you are having many young girls have challenges in going and having access to health services and all of that. You know, from your knowledge, do you have any challenges? You know, your friends, do they have any challenges to go and get the vaccine? What can we do to make a difference? Your first lady is on the call, by the way.
The problem is that the nurses and the doctors have intimidating faces, and so it's hard for people to go and get the vaccine and also ask for help. And also, when you go to get the vaccine, the nurses look at you like you've done something wrong. And so it's hard because you'll be looked down upon when in the actual fact, you just want to get something better. You want to improve your health for your future.
No, I understand. There's a stigma. Of course, there's a stigma attached to what girls are doing. I understand that, you know, but if you look into the challenges and everything you said now, how have you dealt with COVID-19 in your area? You know, do you think COVID-19 is creating stigma as well? And do you mind sharing with us how you're dealing with it? Are you looking after your mental health? Are you eating well? How are you coping with this? Because it's very hard for many people across the world.
It's very hard to go back to how everything was before COVID-19 because everything has been disrupted. And with my peers, teenage pregnancies have also increased in the country. So most are not going back to school because they have to drop out and look after the babies.
That's really amazing. I mean, I just want to say to all the young girls, especially you are an advocate, as the First Lady said, the First Lady of your country said, you are the representative. We need to work with you to make sure you go and tell all of your friends to you know, to get the HPV vaccinated. Progress for adolescent girls has not kept pace with the realities that we face today. So please go and tell all of your friends to do this. Congratulations again for coming to the virtual event. Congratulations.
Thank you.
All right. As we nearly there now, ladies and gentlemen, your excellencies, we nearly there. But before, let me just go now to look into part 2, how we now moving from commitment to action. We can talk until tomorrow, but at the end of the day, we need to take action. So I would like to look into the country perspective on cervical cancer. And I'm going to invite Dr. Kennedy Malama to come and really, you know, PS Technical Service of Zambia Ministry of Health to come and give us a little bit give us some insight. Welcome, Dr. Kennedy.
Thank you very much. Let me start by recognizing the excellences who are part of this very important call, our first ladies, who continue making a big difference in our countries, and we remain indebted to all of you. And all the distinguished persons who are part of this meeting. The Minister of Health in Zambia takes this as a privilege to be given an opportunity to share insights into the Zambian cervical cancer prevention and control program. Let me start by saying the First Lady of Zambia eloquently represented us and alluded to some of the key facts, and I will try not to repeat what our mother alluded to. But for us in Zambia, cervical cancer prevention and control and the overall girl-child subject is anchored in our Vision 2030 for Zambia. And this is how can we make Zambia a prosperous middle-income country by 2030. Within that, we have the national development plans, which span 5 years, every 5 years. So as a health sector, whatever we do, we buy into that overall developmental agenda for our country. And this is the reason we developed our National Health Strategic Plan. And we do have the National Cancer Prevention and Control Strategy 2016-2021. So as I speak, I'll be alluding to the tenets as contained in our National Cancer Prevention and Control Strategy. Indeed, for Zambia, as the First Lady of our country alluded to, the incidence for cancer remains one of the highest in the world. Our incidence for cervical cancer stands at 66 per 100,000 per year, and also mortality or death standing at 44 per 100,000 per year. And one of the reasons is that Zambia is quite good when it comes to reporting in-country, regionally, and also elsewhere. And we do conduct periodic surveys just to ensure that we are current with the information which we have. But the trigger for Zambia was in 2005 when we conducted a study. And this study was anchored on women living with HIV. We wanted to understand more the prevalence of cervical cancer in our mothers, women living with HIV, and also to appreciate some of the abnormalities found on the cervix. So that was a game changer, that survey. Since then, as a country, we moved on to set up the cervical cancer screening, and also in terms of treatment, chemotherapy and radiotherapy. And also of late, we set up the human papillomavirus vaccination program, as our mother alluded to earlier. When you look at cervical cancer screening in Zambia, the bedrock are the nurses. We've managed to decentralize this service, and our nurses, registered nurses and enrolled nurses are the anchor of this program. And the reason is clear. If you want to sustain cervical cancer program, you need to create a critical mass of people who can shoulder this particular program. And in Zambia, we remain indebted to our nurses. Nurses are found in far-flung areas, different parts of the country. You visit a facility and you see them actually taking part in all the processes when it comes to cervical cancer screening. Our mother alluded to the issue of treatment when you look at chemotherapy and radiotherapy for Zambia. For us, the game changer was 2007 when we opened the only cancer diseases hospital in Zambia. To put this into context, our women, our mothers, our aunties, to be referred to Zimbabwe those days, India, South Africa, among other countries for cervical cancer treatment, it was a nightmare. Per patient, we were spending about $10,000 as a country. When we opened our own cancer diseases hospital, we reduced this cost significantly to less than $5,000 per patient. Now, our cancer diseases hospital is attracting some patients from neighboring countries, and we wholeheartedly welcome them and treat them. But we are also using the facility for teaching, and cervical cancer is always a priority. And we are receiving our brothers and sisters also coming to Zambia for training. And this is something we want to develop on further. Cervical cancer for us in Zambia is a big issue. As our mother alluded to, we are talking of an average 2,600 cases diagnosed per year. And these are coming from all parts of the country. And since we opened the Cancer Diseases Hospital, we've seen it ramped up and improved access to treatment. because we have now streamlined the referral system. We are able to do mentorship in the provinces and in the districts. So the hospital in Lusaka, the capital city, is the epicenter. It's the center of excellence. But as our First Lady alluded to in her presentation, we are committed as government to ensure that we decentralize services further for chemotherapy and radiotherapy. And we've already identified 2 sites in the country away from the capital city. And we are optimistic into next year, construction of these 2 centers should commence so that we decentralize service provision. Zambia also, we currently have 2 fellows. These are medical doctors who have specialized in gynecological oncology surgery. They are a game changer because we are now able to do far much more than we used to do. As government, as Minister of Health, we remain committed. We want to create a critical mass of gynecological oncology surgeons who can be able to up the game when it comes to treatment surgically of our mothers and women with cervical cancer. Zambia remains committed to human papillomavirus vaccination program, which we introduced in 2019. And we are happy to mention that initially the target was 14-year-old girls. And the main reason, again, it's the limitation to the number of vaccines doses you get. So we started small, but now we are committed that in 2022, we intend to conduct a multi-age cohort vaccination for girls aged 9 to 14. Initially, it was not easy to start HPV vaccination program. We had a lot of counters against this program. Parents, girls themselves, all levels, religious groups, traditional leaders. But through engagements and having champions like our First Lady, our mother, raising a voice, and other opinion makers in the country, we slowly started gaining ground. And as we speak today, it's good to see that in Zambia, though not all is won, but we are seeing the majority of our people embracing this program. And that's why as government, we are committed to continue scaling it up. When you come to the strategy for Zambia for cancer control and prevention, we have a strategy which is all-inclusive, looking at various forms of cancer. And cervical cancer is one of the highly prioritized conditions in our country. Yeah. This strategy spans 2016 to 2021, and we're already looking at a revision and ensuring that we come up with a strategy which will span 2022 to 2026. That timeline is linked to the developmental agenda for Zambia. So our mission statement in the cancer prevention and control strategy is to provide equitable access to cost-effective, quality, preventive, promotive, curative, palliative cancer care services as close to our clients as possible. We've noted in Zambia, and I know this is the situation in many African countries, that when you look at the continuum of care, promotive, preventive, curative, rehabilitative, and palliative, many of our countries are found wanting when it comes to palliative care services. So for Zambia, we are responding. We've developed a palliative care strategic plan, which is all-inclusive, and cervical cancer is well articulated there. You see that in many of our countries, pain relief is very neglected, including for people living with cancer. But we need to appreciate that pain relief should be readily available, including opioids, for people who require it. And Zambia is looking at that, and our strategy is speaking to that. The vision of our cancer prevention and control strategy is really to have a Zambian public health care system that is equipped, staffed, trained, and empowered to provide a full range of cancer prevention, screening, diagnostic treatment, and care options to our cancer patients and their loved ones. So forging a family-centered approach as we move this agenda to prevent and take care of cancer patients in our country. And of course, our overall goal is to reduce cancer illnesses and deaths in order to contribute to a healthy and productive population. There's no country which can develop if your population is sick, is unwell. And if you see someone living with cancer and they don't get that treatment, they can never be productive. But also what is important is to prevent cervical cancer. Screening is a game changer. Precancerous lesions picked and you intervene. Those whom you pick with cancerous regions early, treat them. For Zambia, we've scored a few achievements when you look at our cancer prevention and control strategy from 2016. And I'll just highlight some of them. One, as a country, we've managed to screen close to 1 million women, giving us a coverage of 40%. We've treated over 100,000 women for precancerous regions and approximately 10,000 women for invasive cervical cancer. I can assure you, without our cancer diseases hospital, wouldn't have attained this level of achievement. We've also trained over 1,000 health workers in our country in cervical cancer screening. And the majority of these are nurses, frontline healthcare workers, and of course, some medical officers, among others, and clinical officers. We've also offered technical assistance to health workers from 13 African countries in the sub-Saharan region. So Zambia remains a center which continues providing support to other countries in this space. We've also opened up over 170 cervical cancer screening centers across the country, with most regions in our country achieving 90% district coverage of services. You'll be surprised, you visit a very rural district and you walk into a mini hospital or a zonal health center and you find that they do have cervical cancer screening services. Very, very encouraging, and we shall continue building on that. But also in our achievements, one of the most important issues we found is that there has been down staging in terms of our people presenting. With cervical cancer, one of the things you see is late presentation. Most of our mothers, our women report very late to health facility. By the time you see them, there's been a lot of damage and metastasis to other parts of the body. But for Zambia, we are making improvements. We used to see from 24% early disease, we are now talking about 42%, those who are reporting early. Initially, it was only 24% who come early, where you can intervene. We've increased that to about 42%, and this is commendable, because with cancer, there is no magic. It's all about preventing through screening and diagnosing it very early, then you get better outcomes. So we hope we can continue building on this, ultimately to reach even 80% and above in terms of early presentation. The last three on the achievements, when you look at 2019 in Zambia, over 200,000 women who are living with HIV were screened for the first time. You are aware that the support from the US government, particularly PEPFAR, the priority is women living with HIV. What we've done in Zambia is, yes, where PEPFAR is supporting us, we focus on that. But as government, generally, it's an all-inclusive program with no discrimination. Whether someone is HIV positive or HIV negative, they have to be given services. What are some of the challenges we've seen in Zambia when it comes to screening and treatment? Pathology remains a challenge. And I think we would want to raise a voice and play an advocacy role to ensure that African countries, particularly Zambia, because I'm from Zambia, we are supported to amplify our pathological services. We need to ensure that pathology services are available in all our regions. Instead of bringing samples to the central level from all parts of the country, we lose the gains in those processes. We've also noted the inadequate surgical skills, as I alluded to. We'd want to have more fellows, more specialized colleagues in these areas so that surgical services are also available countrywide. We've also noted relatively some low levels of awareness on cervical cancer, especially when you go to the rural and the remote parts of the country. And that's why in Zambia, our engagement includes political leadership, civic leadership, traditional leaders, religious leaders, among others. These are very catalytic. But as you know, it's a process. You cannot do this overnight. And before I conclude, let me just refer to the HPV vaccination program. As I said, that Zambia so far has reached 2 age cohorts. And for the first one, we targeted a total of 253,141 girls, and we reached 156,512 girls. And for cohort 2, target 212, we attained 180,209, which was 85%. So we've gotten a lot of encouragement from this performance, and we shall continue building on this. I recognize, as I conclude, the feedback from Nachiriango, our girl from Zambia. Well done, very good remarks. We've gotten the feedback. I'll talk to all the doctors and nurses to put on very good faces. Now we are talking of the Smile campaign in Zambia. And I can assure you, Nachiriango, as you visit the next clinic, I'll tell my doctors to say, hey, let's smile. Let's welcome our girls as they come.
Absolutely.
So it's just to thank the first ladies. Our mother in Zambia has been catalytic to this fight. In fact, most of the encumbrances we've cleared, we remain indebted to our mother, the First Lady of Zambia, and we'll continue looking up to her for inspiration as we move this agenda. Thank you very much for giving Zambia this opportunity. We submit.
No problem. Thank you so much, Dr. Kennedy. It's really amazing to hear everything you've been saying, but also I'm really pleased that you've taken into account what our young girls of Zambia are saying. I love Lusaka, and definitely her equal future means that we'll have more smiley doctors helping all the girls across Zambia. And thank you for being an exemplary country where we can all look up to in Africa. So thank you so much for coming to the event. Thank you. So let's move forward. We don't have enough time, but we have so many important things we need to discuss before we continue. I would like to recognize so many amazing people that we haven't given the chance to to speak. So I would like to recognize Your Excellency Fatima Jabe Bio. She is the First Lady of Sierra Leone. Your Excellency, welcome to our virtual event. Please give us your remark, and we're so happy to have you with us. I love Sierra Leone. I know the work you're doing there as well. Welcome, Your Excellency.
Thank you very much. I'm happy to be here this afternoon. I know we are meant to be celebrating the International Day of the Girl Child, which is the 11th of October. So I'm very honored to be here. Unfortunately, as you all know, due to the pandemic, a lot of things that we should be doing as First Ladies, hands-on and being there together as First Ladies, unfortunately, we're not able to do those things now. But as one of the First Ladies of OAFLA, I believe that cancer is a global issue. And I think as mothers of our own nations, we should consider putting it as one of our top priorities in whatever we do when it comes to campaign, when it comes to advocacy. We should. In Sierra Leone, really, there is not much I can say, because the fact here is that when I was listening to Dr. Kenneth just now, you understand, Dr. Kennedy, sorry, just now, then you understand that, you know, the stories are almost the same everywhere. People coming forward at the right time is very important, but unfortunately in Africa, these are things that don't happen. People will come forward at a very, very later time, and saving them is difficult. For a country like Sierra Leone, where when somebody have cancer and now it is in a later stage of the disease, really, it's a serious issue, because we do not have the facilities to look after them. We do not have the facilities to actually not diagnose but treat them. You know, the closest they can go is Ghana. And if it's not Ghana, they will have to go to South Africa, or they will have to go to India. So that is a very serious issue. And I believe that within Africa, we have those issues. Now, my concern is, because us First Ladies, we all have different priorities in terms of our flagship. And my flagship has been Hands Off Our Girl, which focuses on rape, early marriage, and teenage pregnancy. And that is a campaign that has been very loud around the world. Now, taking up cancer as one of them, cancer is part of my flagship, but it's a little silence on my flagship, because we don't have the facility. Last year, I had the opportunity to organize the International Cancer Day, and that was really bringing an awareness to this nation that we have cancer issues and we have to deal with it, and getting people to come forward. That was the first time even His Excellency the President had the opportunity to let the country know that his own mother died of cancer. So this is just that kind of secret. But then after that, His Excellency has managed to ask the Ministry of Health for them to construct a diagnostic center in the country, and which is now on the planning stage. And I believe that when we have a diagnostic center, we have a where you can go for tests, you can do, they can detect the cancer earlier, then all of these other things, I mean, definitely will come to play, because there is no need of screaming about something when people now start coming forward. Like when we're talking about rape now in Sierra Leone, so many people are coming forward, but then we have all the infrastructure to deal with those issues when they come forward. But then with the cancer, if we do not have the infrastructure ready, if we do not have the hospitals ready, we don't have the doctors. We have, through MAC Foundation, my office has managed to send 10 doctors to go out and train for 2 years for them to have their masters in different disciplines, from oncologists to palliative care to nursing. All of those 10 of them went, and they should be coming back this year. But when they come back, they need the facility to work. So my own submission here, when I listen to GAVI and WHO, of course, they're doing wonderful things around the world. They're doing a whole lot of things. But then as a First Lady, it's a question, just a simple question. Are we all not equal? It's like, how many equals do we have in an animal farm? You know, you have those medicines. I think these are things that you want to also work with every other First Lady, bring it to their country, because every other First Lady will want something like this. Every other First Lady will want to promote something like this. Every other First Lady will want to protect their children with the HPV vaccines. Every First Lady will want that. But then how many of us have it? How many of the First Lady has been offered? How many of the First Lady that GAVI and WHO has actually said, we want to work with you, we want to bring this to your country? How many of us? I don't know about the others, but for me, no, none. Nobody has come to me to say, can you promote this? So this for me is an issue. And I think, like, you know, since we have the platform to say something like this, and through OAFLA, because we are all a member of OAFLA, and I'm hoping that OAFLA will put a presentation for us First Ladies so that we can all have the same thing. We can all have the same opportunities from these organizations, because they're the organizations that are working with us. But if they don't come, if they're not working with us directly, it's difficult. So that would be my submission, and I'm hoping and looking forward to working with all of them. And when our diagnostic center is ready, which I hope will be soon, then my campaign, aggressive campaign on cancer, will be louder than it is now. And I will be able to do more, and not only campaigning, but also while you're doing the advocacy, you are able, because the Hands Off Our Girl campaign is a household campaign, not only in Sierra Leone, but around the world. But I believe that if us all First Ladies, we decided to champion cancer as an issue, because it's a global threat to women, it's a global threat to our kids, we should all come together and say, this is the way we want to go. I know we all have our individual flagships, but then we should all come together also and talk about cancer and educate our people about cancer. But education is one thing, advocacy is another. Not having the right healthcare facility, I think, is a nightmare for us in Africa. So that would be my submission. And I want to say thank you all for having me. And I want to say good afternoon from my end to all excellencies that are here, that we look forward to the day that we'll meet again in person and not virtually. Thank you very much.
Thank you, Your Excellency. You know, I know Sierra Leone very well, and I think that if we listen to what you just said, if we use technology, the advocacy, and make sure that we all work together, I think we can make a big difference for our young girls. I always said there's no need for me to teach young girls how to code if they're not very healthy. And so I look up to all of you First Ladies in Africa to help us. So thank you so much again for coming to our event. We hear you, and I'm sure GAVI and WHO will take action. Thank you so much. I don't want us to finish, but we need to move on with the program. Now I would like to give a perspective from the Cancer Society, and Miss Benda Kitika, she's the founder of Women for Cancer. As the First Lady of Sierra Leone said, we need advocacy, we need education, we need awareness, we need to make sure we let everybody know that women and girls need to be healthy, and cancer is a very, very bad disease. So if we can make sure everybody understand what it is, we will really move forward. So Benda, please, the floor is yours.
Thank you very much. Good afternoon and greetings from Kenya. My name is Benda Kithaka. I'm a health advocate. And today, Your Excellencies, distinguished guests, and fellow panelists, as well as the participants present, I'm delighted to be with you as we're commemorating the International Day of the Girl Child in 2020. And we are discussing why girls' health matters now more than ever. And I'll tell you, in Kenya, 9 women die daily because of a cancer that is preventable, cervical cancer. We have the tools, we have the technologies, and globally, now we have an international call to action to make sure that we can eliminate cervical cancer. Having been in the field for 9 years now in cervical cancer advocacy with Women for Cancer, I can tell you we started from a point where it was an opportunity for us to shine a light on a cancer that was not being talked about then. In 2012 in Kenya, you had more of breast cancer than cervical cancer advocacy. But I am a mother of 2 girls. My eldest is 20 years old. My youngest is 8 years old. And I have a boy who is 10 years old. And when I started in advocacy, I came from a point of it was my sister who was told she had cancer, and it was pre-cancer of the cervix. So at that time, I was doing it for them, my sister, the other women, everybody else who needs to hear that cervical cancer is preventable and can be eliminated. But as I was reflecting on this presentation today, and as I was reflecting on the International Day of the Girl Child, it became personal. Because being a mother of a girl who is 20, who did not have access to the free vaccine from Kenya, but having a girl who is 8 years old, who in 2 years' time, I will be having to take to the hospital to get the vaccination, it matters to me as a mother, and it matters to me as a woman, it matters to me as a auntie, cousin, friend to all the other mothers who have girls the same age. And let me tell you why. As an organization, we've been able to reach the community with screenings for 8,000 women. Compared to the numbers that I've had about from Zambia, I can see the need for governments to be engaged in terms of cervical cancer elimination. Listening to the First Lady from Sierra Leone, Her Excellency, she has mentioned that the First Ladies have initiatives that are already working in country. But the big challenge is how to prioritize and how to be able to merge and collaborate and coordinate the activities in country. And I can tell you, it's not an easy challenge. It is something that requires concerted and deliberate action for us to be able to translate the strategy into an action plan that will be boldly adopted at the country level. I can tell you, our Ministry of Health has been very supportive. When we started in 2012, we were working as an organization for women with a desire to change the cervical cancer space and contributing just $30 each to register our organization, Women for Cancer. Fast forward to 2014, when we first approached the Office of the First Lady, and at that time we were small, we were young, we were still trying to find out how we can create a space in advocacy. The Office of the First Lady was gracious, and they did give us guidance on how we can grow as an organization. One of the critical factors which we adopted was to collaborate and coordinate with other organizations. And I can tell you by the 2017, when our government in Kenya, our Ministry of Health, was looking at setting the strategy for 2017 to 2022, at that point in time, we were seated on the table to inform the strategies for cervical cancer prevention. And that's when the idea of having the vaccine launched in Kenya as part of the preventative measures in Pillar 1 of the strategy. At the same time, we were also sitting on other technical working groups to inform communication. Because at the end of the day, our women are dying for lack of knowledge, that they do not know cervical cancer is preventable, that they may know that it's preventable, but they do not know where to go to get screened. And it saddens my heart to see that we get our women diagnosed so late in the hour, when treatment options are minimized, when cost of treatment is very high, and chances of recovery are really minimized. And so the WHO giving us the strategy for cervical cancer elimination gives us an opportunity to also engage deliberately, that the 90 is not a number, that the 9 women dying daily in Kenya or the number of women dying daily in sub-Saharan Africa are not a statistic. They become people that we know, they become people that we take passionately and want to help, that we can be able to eliminate cervical cancer. Are there challenges to be expected? Most definitely. I can tell you, the one that the First Lady has spoken about being prioritizing is just one challenge. Another one that has been mentioned is stigma and misconceptions about cervical cancer, about the HPV vaccine, about the role of the community, and about the inadequate resources and supplies and commodities, as well as lack of staffing capacities. It has been mentioned by the team from Zambia. Financing for prevention is not as prioritized as financing for setting up cancer centers. And yet this is one of the cancers that we can eliminate through prevention. And COVID-19 presents yet another challenge. But if I was to dwell a little bit on the COVID-19 situation, it also presents an opportunity. For once in the world, we've seen an opportunity where COVID-19 has taught us that health is in our hands. And so let this be a call to action, that we empower women and girls to take charge of their health, that we empower communities to own the strategy, that the First Ladies who represent the country as the mothers who we're looking up to, that are inspiring action in us, are also at the forefront of adopting, adapting, and activating the strategy so that it stops being a strategy with numbers 90, 70, 90. It becomes something that we own and we make alive in our own countries. And how do we do this? I want to present what I call the ABCs for cervical cancer elimination and how we can take it in country and personalize it. Let me start with the A. A is about assessing. Let's go back to our countries and assess, where are we at? What actions have been taken? What are the gaps? Where do we need to bridge it? The B, let's be bold. The strategy speaks about changing the scenario for our girls in a lifetime. That will not be achieved by just setting strategies. It will be achieved by putting bold action plans that are followed with commitments. C, commitment and coordinated action for us to be able to achieve what we set forward for ourselves. D is about declaring commitments. Once we make declarations, I'm happy to say from the WHO, we are aware that all countries have signed on this strategy for elimination. And so declaring action in country means we'll also be able to start engaging stakeholders, which is my E for elimination, engaging stakeholders and also calling people to action. It stops being them, it becomes personalized. We are the ones who are taking concerted effort. And lastly, for me, the F stands for follow through. And I can tell you, in 2015, our First Lady hosted the First Ladies in Africa, in Kenya, for the symposium, for the conference that was on cervical cancer, breast cancer, and prostate cancer prevention. And since then, our First Lady has embraced in her strategy the Beyond Zero medical safaris to be able to reach out to communities and screen. We are one of the partners that is in that collaboration. Our First Lady has also taken active action that the President last year who launched the HPV vaccination in Kenya. Lastly, our First Lady in this year, January, took action to launch the advocacy toolkit with the Ministry of Health and key stakeholders in the cervical cancer elimination space. What does this mean to the rest of the First Ladies in Africa? We have the tools, we have the expertise, we have the knowledge, and we have the technical support that we can be able to cascade this strategy into African-specific targets and African-specific action points for us to act. For all this, follow-through is important. As I come to the end of my presentation, I want to point out that in Africa, we grew up knowing storytelling. And for me, I am active in creating stories with survivors that become lived experience. For the longest time, our women have seen women die of a cancer that is preventable, and it is only right that they think cancer is a death sentence, which is not the truth for cervical cancer. Discovered early, it is preventable. And so my call to action is, let's teach our women to use their voices, strong as they are, towards advocacy. Let's teach our women to take up their lived experience in cervical cancer to inspire others towards early detection. And lastly, let's build a body of advocacy from the First Lady speaking at the forefront, from civil society speaking into our communities, and each one of us having our arrows pointing towards the same direction. Concerted effort for cervical cancer elimination. I'm grateful for this platform. I'm grateful that we are all looking forward to the launch of the strategy, because then together we will be able to eliminate cervical cancer within this lifetime. Thank you very much.
Thank you so much, Brenda. That's so powerful and so amazing. I mean, really powerful. Absolutely needed. Advocacy, women like you in Kenya, working to make sure that we not only we mobilize, we educate, but also we transform people's lives. So congratulations, and I'm gonna come and see you when I'm in Nairobi.
Please, you're welcome.
So we need to finish, ladies and gentlemen, but I would like to recognize again our First Ladies, the Office of the African First Ladies. It is an honor to be a First Lady in Africa. So, and they know that, they know their duties, and they know why they're doing this to help our girls, our boys, and they're our mama, Dr. Kennedy said earlier. You are our mothers, and we look up to you. So thank you for coming. I would like to recognize the First Lady of Angola, the First Lady of Botswana, the First Lady of Burundi, the First Lady of Central African Republic, the First Lady of Gambia, the First Lady of Zambia, and who is really leading this. Thank you again, Your Excellency. The First Lady of Sierra Leone, I have become a big fan of yours from today. I will definitely follow up with you and your office. And WHO, of course, they're very, very busy with COVID-19, but thank you so much for taking the time to coming and see us and be part of this amazing event, which is the International Day of the Girl Child, My Equal Future, My Voice. And GAVI Alliance, of course, we count on them for all the vaccines, and the girls need the HPV. And all the young girls, my friends and my partners, all the young girls who came in to share, your expertise and your personal story with us, we really, really appreciate you. So I will now stop talking, and I will give the floor to, of course, our mama, Her Excellency, Madam Auxilia. I'm going to pronounce this correctly now, Manguagwa, the First Excellency of Zimbabwe, to come and close. And then thank you so much again. It was my honor to be your moderator. Thank you.
Yes. Yes. Thank you very much once again. I feel highly honored and privileged to be part of this webinar to celebrate the Day of the African Child and to have been accorded the opportunity to address you all, including hearing from my fellow sisters, African First Ladies here present, and from our partners as OAFLAD. I want also to thank the President of OAFLAD, Her Excellency Madame Antonessa Songweso, to have accorded me to stand in for her. To the presenters and panelists, I say thank you for your valuable contributions and insights as we work to address the scourge of cervical cancer affecting our girls and our women on the African continent. To my fellow African First Ladies in OAFLAD, I know how busy our schedules are, and yet you and I found time within our busy schedules to participate in this very important webinar. The OAFLAD Secretariat has done a sterling job in pulling this webinar together and we thank them for their tireless efforts in supporting us as First Ladies to better support health and development efforts in our respective countries. A key message that we should take home is that we should all collectively take it upon ourselves to rally behind the call to eliminate cervical cancer as a public health problem by supporting HPV vaccination for girls and supporting early screening and detection of cervical cancer. The COVID-19 pandemic has really affected HPV vaccine coverage as the target group is school-going children, and we need to continue looking at innovative ways to make sure girls do not miss the opportunity to get vaccinated against the human papillomavirus. Even women and girls have been affected by the COVID-19 induced lockdowns and travel restrictions. As such, screening, diagnosis, and treatment for cervical cancer have been negatively impacted by the COVID-19 pandemic. I know that as mothers of our nations, we can be creative and strategize on how to mitigate against the negative impact of COVID-19. I hope that a vaccine will be found that is safe and effective against this deadly coronavirus as soon as possible. I wish to thank you, our moderator, for the session today, Lady Mariam Jean. Sincere gratitude to all our partners and funders who made this webinar possible, who are UICC, WHO, GAVI, and NCD Alliance for collaborating to make this webinar a success. On this one, I would want to say, we ask for the services of our partners to come and work with us directly in our countries, as alluded by the First Lady of Sierra Leone. In this case, it will also help First Ladies and promote whatever they're doing in their countries. To our daughter in Zambia, yes, our health system, doctors and nurses, I think they've heard for themselves. We also say to them, they have to be receptive and also have cheerful faces when patients come to the hospitals. I thank you all and goodbye.
Thank you, everyone. Thank you so much for being part of this amazing event. And thank you, the Office of the First Ladies, again. It was my honor again to moderate this session. We'll follow up. Make sure you follow with all of the partners. And thank you again and goodbye. Until next year, hopefully we'll meet in person. Thank you. Goodbye.